If you have knee pain and someone has mentioned surgery, the question on your mind is almost certainly the one I hear most often. Can this heal without an operation? Let me give you an honest answer, because the truth is more encouraging than most people expect, but it comes with some important conditions. For the large majority of knee problems, the answer is yes, surgery is not your only option, and very often, it is not even the best first option. Let me explain why. The knee is a joint that responds remarkably well to loading when that loading is done correctly and progressively. Most knee pain does not come from something broken that needs to be repaired. It comes from tissue that has been overloaded, undertrained, or both, and tissue like that responds to rehabilitation rather than to a scalpel. Take the most common cause of knee pain in adults, which is pain around or behind the kneecap. This is overwhelmingly a problem of how the kneecap tracks and how well the muscles around the hip and thigh control the joint during movement. There is nothing to cut out and nothing to stitch back together. It improves when you rebuild the strength and control that should have been there in the first place, and surgery has very little to offer it. Even conditions that sound like they obviously need an operation often do not. Take the degenerate meniscus tear, the kind that shows up on a scan in middle age. For years, these were routinely operated on until high-quality studies compared surgery against a proper exercise program. The finding was striking. For most of these tears, structured rehabilitation produced outcomes just as good as surgery, without the operation and without the recovery. The same story has played out with knee osteoarthritis. A strong exercise program, combined with managing your load and your weight, consistently reduces pain and improves function, and it is recommended as the first-line treatment before anyone considers a joint replacement. So when is surgery genuinely the right call? There are real situations where it is. A fully ruptured ACL in someone who wants to return to pivoting sport, a meniscus that is physically locking the knee so it will not straighten, a serious traumatic injury with structural damage. Those are clear surgical conversations, and I would never tell you otherwise. But for the everyday knee pain that brings most people to see me, the aching, the stiffness, the pain on stairs, the swelling after activity, surgery is usually not the answer, and trying rehabilitation first costs you nothing except a few weeks of committed effort. Here is what honest rehabilitation actually looks like, so you know what you're signing up for. It starts with finding out exactly why your knee is overloaded, which means looking not just at the knee but at the hip, the ankle, and how you move. It builds strength progressively in the muscles that protect and control the joint, particularly the quadriceps and the muscles around the hip. It manages your activity so the tissue is challenged enough to adapt, but not so much that it stays irritated. And it takes time, usually a matter of weeks to a few months, not days. Anyone promising to fix your knee in 1 or 2 sessions is not being straight with you. The reason I push rehabilitation first is simple. If it works, and for most people it does, you have avoided an operation, the risks that come with it, and a long recovery. And if it genuinely does not work after a fair trial, you have lost very little, and you walk into any surgical conversation stronger and better prepared, which improves the outcome of surgery itself. That last point deserves more attention than it gets. The strength of the muscles around your knee before an operation is one of the best predictors of how well you recover afterwards. So even in the cases where surgery is genuinely needed, doing the rehabilitation first is not wasted effort, it directly improves the result. This is why I never see a trial of physiotherapy as a delay or a gamble. For most knees, it resolves the problem outright, and for the few that still need surgery, it makes that surgery work better. There is no version of the story where building strength and control in your knee leaves you worse off. Let me leave you with the warning signs that do mean you should be seen promptly rather than waiting. For everything else, the aching, the stiffness, the pain on the stairs, the swelling after a long day, rehabilitation deserves the first attempt. So before you accept that an operation is inevitable, get a proper assessment of what is actually driving your knee pain and whether a structured program can resolve it. The link in the description connects you with physiotherapy that can give you that honest answer for your specific knee.